Hi, Dr. Saxena here, and been talking on different forums. And one of the forum, I was being asked, what is you mean by what is your take on something called anti-aging medicine? Having worked or having gone and attended, there are some things called A4M, and so I can always tell you this is one of a very good form of medicine where you are trying to, because what happens is most of your 90% of all your adult illness is because of degenerative process of aging. This includes heart disease, cancer, adult onset diabetes, you have stroke, high BP, you have osteoporosis, your osteoarthritis, you have something like autoimmune disease, and we see now Alzheimer's in a big way, Parkinsonism. So these are all the age-related factors, and it is 90% of this are because of the degenerations which is happening because of the epigenetic changes, and we need to work on that. So this anti-aging medicine is a form. It's based on early detection, prevention, and reversal of age-related problems. So, what are the things which we try to talk about? There are three golden rules in anti-aging medicine, which is called one is that don't get sick, and the second one is called don't get old, and the third one is don't die. Of course, all things are partially possible. The number third thing is see, these are the rules which has been talked about. So we as a whole, we talk about yes, there are some things which has to be worked out, and anti-aging medicine is the newest clinical medical specialty, where you are looking at the optimum of wellness and longevity, and employs extensive therapies and treatments in the prevention of healthcare field, far beyond just cholesterol testing and mammography. We used to have thing. They used to tell that if you have a cholesterol, if you have your cholesterol tested, take a lipid lowering drug, and you go to a mammogram for detection of cancer. Take a hormone replacement therapy for your thyroid, testosterone, estrogen, and all that. So if you have tested your cholesterol some time back, and you have checked it, it is anti-aging medicine. It is like prevent looking at things. If you have taken a mammogram to know what's happening to your, are you a candidate for cancer or not, you are following anti-aging medicine. You are brushing your teeth, it's a preventive anti-aging stuff. So if you had happened to take something like thyroid hormone tablets, you are supplementing thyroid, people have been supplemented on melatonin, DHA. So when you have done that, you have already experienced what is called this anti-aging medicine. I always believe that if you can slow aging, we can eliminate more than 50% of the diseases overnight. It's a big statement, I think, but we have to focus on degenerative diseases of aging more, because I certainly believe that this is the kind of thing which is going to happen over a period. Already it has happened. People have started talking about, we need to talk about this particular stuff. So the concept of this anti-aging, what is being told about this particular stuff, is aimed at detection, prevention, treatment, and reversal of this age-related decline. So we are proposing something like a healthcare model promoting innovative science and research to prolong the healthy human span. A lot of people have done some. In 1993, somebody has coined something like healthy aging or successful aging or happy aging instead of anti-aging. So all things are quite good, but I somehow believe that people take it for granted that this is an age-related decline, and you can always work on that. You can always look at how best you can go for this reversal as well as prevention part. Having looked into all these things, we had gone on record telling that this anti-aging transformation involves multiple things. It is something like a process where we work on a lot of antioxidant analysis and putting up a lot on antioxidant therapy, trying to optimize the supplementation. It can be something like your magnesium, or it can be something like a simple iodine or selenium, or maximize immune function, where we try to work on the microbiome, gut microbiome, as well as trying to work with some other things which help in maximizing your immune function. Your innate immunity gets stronger with that. We work on detoxification, we work on cardiovascular protection, we work on endocrinology, and basically what we are trying to work it out is this is called bioidentical hormone therapy. This bioidentical hormone therapy is a new thing, and we believe that someone who is taking a thyroid tablets, they understand what is bioidentical hormone. Because the things which were being put across, there was a hormone replacement therapy which used to be given by the for the women above beyond menopause. That was having a lot of side effects and all that, because all the synthetic drugs, particularly medroxyprogesterone, was a big issue. Don't want to get into that, but I can always talk to you about what is a bioidentical hormone. Bioidentical hormone is a natural kind of thing. If I want to tell you this is water, it's H2O, and I just tell you, okay, there is something else also called H2O2, and it's only just one addition of oxygen is there, and it's almost similar to water. It doesn't fit here exact. You can sip this glass of water, H2O, but you cannot take H2O2. So bioidentical hormone is exactly replica. And now you are talking about, people are talking about human insulin. That is bioidentical hormone. There is a natural extracts also. There are some things which we talk about. We can always look into later. So this anti-aging transformation, what I'm talking about, it has got something to do with the cognitive function, assessment and repair. Number one. Another one is metabolic and DNA repair. The third one is skin. Skin repair also, because you need to work on the collagen, aesthetics also. When we talk about anti-aging, we believe that that should come from inside. Your hormones should be normal, your minerals, every stuff should be quite of thing, and you should be in optimum health. And the kind of, we always look at the skin also as an important thing, and so that we need to look at what is the collagen, what are the wrinkles which has come. Needless to say, we have a lot of lifestyle modification things which we try to advise to the patient, right from the diet to so many things in exercise. There is a musculoskeletal rehab also happens here. There is a sports medicine component is there. We try to do some conditioning. In the sense, most of the people, sports person who come for us, they are interested in something like hyperbaric oxygen, ECP and all that, so that they increase the endurance of their thing. And what happens once they go through these therapies, these are all oxygen based or some things. It's not having any kind of, it doesn't cause any, it's not like drugging the body or getting the dope per test positive. So what we are trying to work out is, yes, we are enduring the strength of the muscles, everything gets strengthened, number one. And if they get into some kind of sports injury, their recovery time gets hastened. Normally 3 weeks or 4 weeks, once a injury occurs to any tendon also, it's a 3 to 4 weeks, minimum 6 weeks time. So once we do this preconditioning with this our modalities, the recovery time is as less than 10 days or 15 days. So that's the kind of things what we have to offer into this particular thing. And it's like, I can always tell you, that's because of so many things, lifespan has been climbing. Just with the last pandemic, things are going in a different turn. But usually people are having a good kind of human span is increased, and what we had seen is there are some things which work at tandem. We try to work on some of the level. There are some body levels of some substances which decline over a period of time, and we try to work it out by improving that particular stuff. So simple things, it consists of something like carnitine sulfate, it consists of creatine, something like carnitine, simple stuffs. We have got some lutein, very not very this one. So this there are studies which show the antioxidants prolong lifespan. Yes, the study interestingly was the earthworms given synthetic versions of antioxidants survive 50% longer than their untreated counterparts. And similar is the case with superoxide dismutase and catalase mimetics. So vitamin E, a simple vitamin E prolongs lifespan. It is being already proved, and this is mostly done with the animals and earthworms and all. But I can always tell you, we can always extrapolate into the humans also. And this particular thing which we try talking about diet and all that is it has to be looked into. It's simple. This the most common thing, important thing which prolonged lifespan is a low carbohydrate diet, low calorie diet. In fact, low carbohydrate diet. It's a low calorie diet, which is there has been a paper which was presented in 2001, and it was proved that low calorie diet. There is a thing called antioxidant cocktail, and it quadrupled the lifespan in mice. This antioxidant cocktail consists of something like there is a set of simple things which helped a lot, and it's all kind of they are not very these are dietary supplements, what we call. So has got regenerative medicine has got an immense role, and I can always I think this is the next level what all of us has to look into this thing called because everyone is aware about what is the stem cells, what is the homeopathic stem cells, and so everyone is talking about that. You get peer-reviewed studies talking about how you are decreasing the shortening of telomeres, and this hyperbaric oxygen is a very I felt this was not very this one, but this simple one thrice a week hyperbaric oxygen has got the potential to prevent that aging. That is one thing which I came to know after practicing hyperbaric oxygen after some time. So this is new things on the horizon, and I certainly believe that yes, people do have, but we try to look at like that. I'll try to put it like that. Improve your quality of life, and no matter whatever how many years you live, and it's something like you see some Bollywood personalities trying to look into that, and they work 12 to 16 hours a day in spite of whatever age they are, and so what makes them kind of thing. So a lot of scientific advancements have come, and simple things also can be tried initially, so that you can always optimize your health. And look at this, what I'm talking about. There is a big role about trying to see that the rapidness of aging can be slowed down by all these modalities. Thank you.